Yeah, no, we're incredibly pleased with these results, and the reasons are that what we're doing is we're actually moving beyond the randomised controlled trial populations, which tend to be sort of very carefully selected to an entire population. So we studied the whole of Scotland, studying, over 1 million doses of the vaccine that have been rolled out, and some very encouraging results.
What specifically was the strategy that was used?
So our approach was to link our GP records with vaccination records, testing records, and hospitalisation records. So we've done this for the entire population, that's 5.4 million people. And what we've been doing is looking at those who've been vaccinated and carefully comparing them with the unvaccinated and trying to work out the risk of hospital admission for COVID-19.
And how intensive a process is that? And does your health system have to be very robust to allow you to do that?
So what you do need is an electronic health record infrastructure. So this is a platform that we created over a decade ago. We did this in the context of the H1N1 or swine flu pandemic. And what we've done is we brought that out, expanded it, augmented it, and then as a result been able to use this incredibly rapidly to generate some initial results of the effectiveness of the first dose of the vaccines.
Talk a little bit to the fact that there was just the first dose. This was based on just one dose. Why do you think it was so effective with just that one dose?
Yeah, so the vaccine programme in Scotland only began in early December. So at the moment, we've only been able to study the first dose of the vaccines. We will, in due course, be able to report on the second dose, and we hope to do that pretty shortly. But the first dose is the one that seems to be providing the majority of the protection. The second doses are booster doses, and I think that's what the trials were showing, and that's what we're finding out in everyday populations as well now.
And do you think then that that second dose is necessary?
I think it is necessary because at the moment we've only been able to track individuals for at least for up to 6 weeks after the first dose of the vaccine. So the effect of that first dose may wane. We're not sure at the moment. We're going to be studying that in due course. But what we also know is that these are not providing 100% protection. And the hope is that the second or booster dose will actually provide additional protection, which is what we all want.
What is it telling us about how this virus can be managed into the future?
Well, I think this really provides us some very important information about vaccines being fundamental to trying to return to some sort of long-term plan of normality. What we also know now is that the majority of our protection is coming from the first dose. And so I think that may have an implication for governments as they think about what they do, because we're all struggling with limited vaccine supplies. So is the approach to try and get a first dose into as many people's arms as possible and provide that majority of protection, or is it focusing on a subset of the population and providing the first and second doses to those individuals? So, I think those are big sort of policy decisions, but our analysis suggests that there may be merit in actually trying to get as many people immunised with the first dose as possible.
That is interesting. Let's think for a moment about the level of infection that is, say, in a country like the United States. Now, they're having a massive rollout of vaccinations. Are we likely to see it as effective in terms of bringing down hospitalisations and infections as you've seen?
Yes, I think so, because, if there's a lot of infection around, there's a lot of people contracting the disease, a fair proportion of them developing severe disease, so there's more opportunity for the vaccine to make a difference. So, yes, I envisage that there will be, hopefully very similar findings, possibly even better, as the vaccine's rolled out in the US.
And how do what advice would you give to countries that don't have those kind of electronic systems in place in terms of managing this?
Well, I think a number of countries are now reporting data on vaccine effectiveness, as these are being rolled out at population level. So Israel reported over the weekend. We reported in Scotland. I mean, England has reported yesterday as well. And they're all showing very similar findings, that the vaccine seems to work very effectively, and that begins to work with the first dose. So I think if there isn't the mechanism to, evaluate, then there isn't. I mean, I think the longer term we need to develop strategies to do so. But at the moment, I think governments can be reassured that these vaccines are very effective, because we're seeing very similar signals now in different countries, different health systems.
Well, it's fascinating and very encouraging indeed. Great to get your insights as having been part of the study.
Nice to speak with you.